Imagine this: you slip on the stairs, feel a sharp pain in your arm, and rush to the emergency room in the United States. In that terrifying moment, you're not only worried about the broken bone, but you're already thinking about the bill. Because in America, without health insurance, even a short ER visit can leave you drowning in debt. Many people outside the US are shocked to discover that a single ambulance ride can cost between $500 and $2,500, sometimes as high as $5,000. And that's before you even step into the hospital. Once you arrive at the emergency room, the costs begin to snowball. The average facility fee just for walking into an ER can range from $1,000 to $3,000. Then come the diagnostic tests. A simple X-ray may cost a few $100s, a CT scan can be $1,200 to $3,500, and an MRI might be $2,000 to $7,000 depending on the hospital. If you need to stay overnight, one night in a general hospital bed averages around $2,500. And if you land in intensive care, the bill can shoot up to $10,000 per night. Add surgery to the mix, and the numbers become staggering. An appendectomy, one of the most common emergency surgeries, typically costs $13,000 to $30,000 if you are uninsured. Heart surgery or trauma care from a car accident can easily climb above $100,000. There are countless real stories of Americans who face these situations. A college student broke his ankle during a soccer game, went to the ER, received scans, anesthesia, and a short surgery. Weeks later, the bill arrived, $35,000. With no insurance, he was forced to pay in monthly installments that will take him years to finish. Another widely reported case involved a man who was bitten by a rattlesnake and required antivenom. The hospital bill? Over $40,000. In another, a woman was billed $20,000 just for an ambulance ride after a car crash. These are not rare horror stories. They are happening every single day in the United States. So why is healthcare so expensive here compared to the rest of the world? There are many reasons. The first is administrative costs. The United States spends 3 to 4 times more on healthcare administration than other developed nations. There is a massive amount of paperwork, billing systems, and private insurance bureaucracy. The second factor is drug pricing. Prescription medications in the US can cost 2 to 3 times more than in Canada or Europe. For example, an EpiPen that costs less than $50 in the UK can cost $600 in the United States. Hospitals and providers also have the freedom to set their own charges, often without transparency. Patients rarely know the true cost of treatment until the bill arrives. On top of that, malpractice insurance and legal protections for hospitals are expensive, and these costs are passed down to patients. Unlike Canada, the UK, or Germany, the US does not have universal healthcare, so the system is largely privatized, which adds further profit motives. When you compare the experience of someone with insurance versus someone without, the difference is shocking. If you break your leg without insurance, you may face a bill of $17,000. If you have insurance, you may pay only your deductible and a copay, perhaps $1,000 or $2,000 in total. Childbirth in the US without insurance ranges from $15,000 to $30,000, but with insurance, families may pay only a few thousand. A severe car accident can generate trauma care bills of $50,000 to $150,000, which insurance can reduce dramatically. This is why more than 90% of Americans either purchase private insurance, rely on employer plans, or are covered by government programs like Medicare for seniors and Medicaid for low-income families. Still, tens of millions fall through the cracks, either unable to afford premiums or not qualifying for assistance. The financial consequences are devastating. Studies show that in 2019, nearly 2/3 of all bankruptcies in the United States were linked to medical bills. That means ordinary families, people with jobs and homes, lost everything because of one health emergency. To cope, many Americans turn to crowdfunding platforms like GoFundMe, where over 250,000 campaigns each year are related to medical expenses. Imagine relying on strangers on the internet just to afford basic healthcare. There are ways people try to protect themselves. Some negotiate bills, because hospitals will sometimes reduce charges if you ask. Others go to urgent care clinics for minor problems, where a visit may cost $200 compared to $2,000 in an ER. Foreigners visiting the US are always advised to purchase travel insurance, because even a small injury could cost thousands out of pocket. Certain nonprofits and charity programs help forgive bills for low-income families, but this requires paperwork, proof, and time. When you compare globally, the US is an outlier. In Canada, emergency room visits are covered through taxes and patients pay nothing at the hospital. In the UK, the National Health Service covers ER care. In Germany, health insurance is mandatory but affordable, with strong government regulation. Meanwhile, the US spends over $12,000 per person annually on healthcare, the highest in the world, yet millions of people remain uninsured or underinsured. There are debates about how to fix this broken system. Some advocate for universal healthcare similar to other developed nations. Others prefer to maintain a privatized model but with reforms, like price transparency and negotiated drug costs. Medicare has recently begun negotiating the prices of some prescription drugs to lower costs, and there are pushes to expand Affordable Care Act coverage. But the road to real change is long and politically complex. What all of this means is simple. In the United States, a single accident, a single illness, or a single night in the emergency room can change your financial future forever if you don't have insurance. Healthcare is essential, but in this country, it is also one of the greatest financial risks that ordinary people face. So what do you think? Should the US healthcare system change to protect people from these crushing bills? Or should individuals remain responsible for purchasing private coverage in a free market system? Whatever your opinion, one fact is undeniable. The cost of emergency care in America without insurance is shockingly high, and it is something every person living in or traveling to the US should be aware of. If you found this information eye-opening, share this video with friends, especially those outside the US who may not believe just how expensive American healthcare truly is. Don't forget to like, subscribe, and turn on notifications because in upcoming videos, we'll continue exploring the financial realities of life in America, from insurance to housing to education. This is not just information, it's survival knowledge.